Hi, I'm Dr. Sridhar. I have mentioned in some of my earlier videos that in a baby with respiratory distress, we prefer 2-hourly orogastric tube feeds. The reason I'm mentioning this is because these babies are on non-invasive ventilation. Orogastric tube is more used because nasal interface like high flow or CPAP goes through the nose in these babies. So once you have the orogastric tube and there is a gas bubbling through the nose for the non-invasive ventilation, you have a high chance of reflux happening, and this is physiologic reflux. Of course, you position the baby elevated to 30 degrees or so to reduce this, but in addition, reducing the amount of milk in the stomach at any one stage is going to reduce the risk of reflux happening. And reflux in the small babies leads to microaspiration sometimes or reflex laryngospasm, and when the laryngospasm happens, the baby holds a breath and you may end up derecruiting the lung. The functional residual capacity comes down, the hypoxia may cause an apneic response, and this becomes a cycle. I've mentioned earlier that to reduce intermittent hypoxemic episodes, you can keep non-invasive ventilation at a certain level till the baby is bigger. Similarly, keeping them on a 2-hourly feed still they are tolerating is better. It's not too strenuous on the nursing staff like hourly feed option, and it's not as stressful for the baby as a 3-hourly. We suggest coming off the non-invasive support and then move to 3-hourly and oral feeds. Even oral feeds, if the baby is mature as well, even if you are on non-invasive support and you give oral feeds, there is a risk of aspiration. So what you gain from this isn't significant because anyway the baby is unlikely to go home till they are ready coming off the non-invasive support, and by waiting till they are coming off the respiratory support, their lung is ready to cope. They will suck better, and more mature babies suck quicker anyway. So for that reason, we don't offer suck feeds also in a baby on non-invasive ventilation unless it's a chronic lung disease baby who is staying in the unit for a long time and who has been fairly stable. I hope this helps. Thank you.